Hi, I'm Kevin, and today I'm going to introduce about targeted therapy. Okay, to start with, what is targeted therapy? The targeted therapy is a type of cancer treatment that targets proteins that control how cancer cells grow, divide, and spread. It uses the information about a person's genes and protein to prevent, diagnose, and treat disease. It acts on specific molecular targets associated with cancer, deliberately chosen or designed to interact with their targets. And nowadays, we have different types of targeted therapies. Next, we may be curious about the mechanism of targeted therapy. The angiogenesis inhibitor, for example. This kind of inhibitor targets blood vessels that supply to cancer cells. When this blood supply is cut off by using the angiogenesis inhibitor, the cancer cell's growth slows down or stops. Also, we have some other kind of inhibitors as well. The kinase inhibitor. It attacks the proteins inside and on the surface of the cancer cells to stop them from growing and dividing. It targets the catalytic site of the enzyme and reduces the activity of enzyme, blocking the abnormal enzyme signals that make the tumor cells divided. It's clear that there are numerous benefits of targeted therapy. High precision, for example. It specifically targets cancer cells or specific molecular pathways involved in disease progression, reducing damage to healthy cells. Also, it has a lower side effect since the target therapy are designed for only certain parts of the disease process. They generally have fewer side effects than normal ways like X-rays and chemotherapy. Also, the biomarker testing can help monitor the effectiveness of therapy and guide adjustment in the treatment as needed. However, there are still some drawbacks of targeted therapy. The resistance can happen when target itself changes, and target therapy is not able to interact with it. And it can happen when cancer cells find new ways to grow that do not depend on the target. Meanwhile, the drugs for some targets are hard to develop, which means that not all cancers can be treated with the target therapy. Reasons include target structure, target function in the cells. And finally, till now, the target therapy is still one of the most effective treatments for cancer, aimed at helping patients improve their standard of life and ensure a corresponding enhancement in their living standard, which is achieve our goals of human well-being. And we also hope that there are more target drugs will be available in the future. So that's all of my presentation. Thank you for watching.